Welcome, everybody. My name is Dr. Phil Harrington. I am the medical director for Summus Medical Laser, and we have a very special guest with us today, Anthony Jackson. And Anthony was treated with our laser at an event a few months ago, and Anthony had been dealing with a number of injuries as a result of his service for our country, which we certainly appreciate that, Anthony. So welcome, Anthony, and it's very nice to have you with us today.
Thanks. Glad to be here.
And so if we can, and we won't make this a real long interview, if we could just get a little summary of what was the nature of the injuries that you were experiencing at the time, and how was it impacting your life?
Certainly. So initial injury was back in 2000 for my left shoulder. Dislocated it on a airborne operation, and then just years and years of overuse injuries. It only was re-injured a handful of times, much less significant, but that the compounding effect of 20 years, over 20 years, was just awful. And then my right shoulder was also dislocated, not as severely. And I was actually just speaking with an orthopedist about it this morning, looking at the images and talking about the different types of injury. And the right shoulder, I was blown out of a truck in 2003 in Afghanistan, landed on it, and it was sometime the next day before it was really treated. And then again, years and years of overuse injuries, getting just enough treatment with physical therapy and injections. Back then, a lot of the cortisone and steroid injections just to keep going, right, and really tearing myself up even more.
Right. Yeah.
And so before the conference in June, I really struggled. I could almost go straight in front of me, and actually, I think one was slightly worse than the other, but passed straight in front of me. I don't know if you can see that very well. It was just incredibly painful. And I've got over 90-some % range of motion again without any pain. It's remarkable.
All right.
So pairing the PRP, which itself was unpleasant in this, in the moments of it, as far as the discomfort and that sort of thing. But getting the laser treatment within, I think it was just within an hour after I walked out from PRP.
Okay.
And it helped just with so much. So it was a nice, warm, really comfortable, kind of like when you're really sore and you get into a hot tub and you have kind of that relief from heat and and that sort of thing. It was I would pair it very similar to that, but at a much more significant level.
Okay.
And then I did it again the next day. The doc, of course, treating me for PRP had said, don't, at a more extreme level, you might not be able to use your arms in the morning. And they were pretty sore that next morning, very difficult. I kind of lifted one with the other arm. And then a few hours later, getting the second round of the laser treatment, I was much more functional than I think anyone expected for just the next day. And I have had nothing but great things to say about the process since.
That's great. So we're talking, it's late October. I think the date's the 24th today, I believe, October 24th. And you had these treatments done in late June.
Correct.
So there is July, August, September. We've got 4 months have passed since then. And it's good to see that your range of motion is staying good and the pain levels are staying down. That's encouraging to see. And so as far as the event was happening, it was Gulf Coast Biologics. It was at a venue in Fort Myers, Florida, where we have been working together with this regenerative medicine company. And we have better than 15 years track record with the laser itself. And we know that laser treatments alone can help with pain, inflammation, tissue damage, that we can help with those injuries. And it could be either an acute injury or more of a chronic pain situation like that. And what's very encouraging is that in the last couple of years, we're getting more evidence to show that that our Summus laser treatments work very well together with regenerative medicine injections, such as platelet-rich plasma and stem cell injections. And we talk about the laser being used in three ways. First, we can use the laser before the injection to help precondition the tissue and make it healthier. We can use the laser treatment immediately after the injections, which is what you had, to help with that post-injection pain. And then also there are studies that show that there's a nice synergistic effect between the laser therapy treatment and the regenerative medicine injections.
Right.
So the second point there, as far as when they're putting these needles into you, I'm sure that was pretty painful, right?
Yes, very much so.
And so I'm curious, as far as the use of the laser, could you feel some reduction of that injection pain while the laser was being run on you, or shortly after that?
Yes, so it was really fascinating. Instead of just like a warm compress or a heating pack or something that's kind of very minimal and short-lived, it was such a deep penetrating warmth, and it didn't just last for a few minutes. It took that pain that had been just, I mean, it was just throbbing. It's kind of a full sensation, like pressure, and from the PRP, I mean. And using the laser, it just really reduced that fullness, the throbbing. It lowered it and kept it lower. It wasn't just a 5-10 minutes. It was the rest of the day, and then going on, came back.
And so what you're telling us as far as what a patient feels during the treatment, that's common. You feel the heat from it. It feels warm and soothing and comforting. But then we always make sure that we emphasize that laser therapy treatments are not a heating modality. The benefit that you're getting is not coming from simply that elevation of tissue temperature. It's
right.
those photons of light are traveling, and it's so cool how it works out. We're just, those photons of infrared light are getting deep into several centimeters into the tissues in the body. And there's many different things in the body, we call them chromophores, that absorb those photons of light and have various beneficial effects. And what you said about that, the benefit that you felt being long lasting, sometimes the treatment on your shoulder maybe took 5 minutes or something like that.
The PRP or the laser?
With the laser, yeah, the laser treatment.
Yeah, I'm trying to remember. I know he had to type it all in, what the injury was, the area, and it did the calculations for him. And I'd say probably between 5 and 8 minutes per shoulder.
So it doesn't take very long,
No.
but the benefit that we get is goes on for 24 to 48 hours after the treatment, or even longer. So that's I'm just so pleased to hear that you were able to experience that. And so your range of motion, Anthony, before and after, before what, you could only lift your arms up so far, and then after treatment with the PRP and laser, you could have almost full range of motion?
Yes, it was phenomenal. I mean, within one day, I went from 40-some%. Both of them were under 50% range of motion. By the next day, I was in the 90% in both of them. And it just continued to, throughout the next week and so on, it just continued to grow.
All right. And then in the 4 months since the conference, in this time period, have you had any additional treatment on the shoulders at all?
No, I haven't. I was actually just thinking about that this morning as I spoke with the orthopedist, and I've kind of jumped in. The sort of next thing for me is I'll be doing my C-spine soon. And so one of the conversations there is how to better pair the laser instead of just a couple of treatments, during the conference. And so what we were already speaking, the two doctors that we were conferencing with, and the gentleman that is going to do my C-spine highly recommends pairing before, during, and before, during, and after type of thing.
Good.
Sees a lot greater benefit.
Okay. Well, that's great. And I mean, the reason that this all happened is the VIP, the Veterans in Pain program.
Yes.
Now, I regret that I was not able to be at this conference in June. Can you tell us a little bit about the VIP program?
Yeah. So let's see. I think it's been about a year ago that I got set up with them, and just started a conversation, what they are doing, who they work with, and some of their goals. And so realizing that a lot of my day-to-day has been restricted due to chronic pain, we talked about a plan of action that made the most sense based on their experience with my type of injuries, and so shoulders and neck. But then while we were waiting on getting MRIs, getting those to the doctors and waiting for a conference and things, we set up and they sent me to do a ketamine treatment, ketamine IV, to help with kind of lower some pain and anxiety ahead of time, so that my body could heal even better before the conference.
Okay. All right. Well, really appreciate your time today, Anthony, and I'm so happy that the combination of the PRP and the Summus laser treatments have helped you and kept you out of pain and given you that range of motion. And well, I have to ask, would you recommend Summus laser treatments to other patients in pain?
Yes, absolutely. And I'm really looking forward to pairing the pre-treatment with the Summus laser before my C-spine injections, and then continuing and doing much more than the two, and really getting the full benefit of the pairing. So it's exciting.
Yeah, that's great. I'm real happy to hear that they're going to be able to do that. So any final thoughts, or is there any part of this story that we missed?
Can't think of anything that was missed, except I wish I had heard about it sooner to get some of the pre-treatment. Yeah.
Yeah. Well, maybe with you getting the message out this way, it'll help others to to get help with laser and PRP, and it's so rewarding to see these advancements of technology and healthcare, and being able to help patients. Now, of course, with the regenerative medicine injections, there is a little bit of an invasive procedure there with the joint and with the injection with the needle. But with the Summus laser treatments, we always talk about them being, it's non-opioid, it's non-invasive, and there's really virtually no side effects. So the benefit with the laser treatment being that non-invasive opioid-free solution for pain is really a big thing. And we're seeing this treatment being used more and more in healthcare. So it's really rewarding to see that. Yeah. So, well, thank you so much for your time today. I really appreciate it. And I hope I get to meet you sometime down the road.
Certainly. Yeah, thank you.
Okay. All right. Folks, we appreciate Anthony Jackson being with us today from the Veterans in Pain from the VIP program, and sharing his experience with us. So take care and bye-bye.